Hello, I am Dr. Necati Uğur Hazar, specialist in brain and spine surgery. In the last video, we talked about non-surgical treatment options for lumbar disc herniation. In this video, I would like to continue from where we left off, but this time focusing on the situation where surgery might be necessary. My aim is to help the patients better understand their options, ease some of their worries, and explain how we can support them through this process. So let's start. What is the surgical treatment for a herniated disc? Lumbar disc herniation, often referred to as a slip disc or herniated disc in the lower back, is a common spinal condition that can lead to ongoing pain, numbness, or weakness, particularly in the legs. While many patients respond well to non-surgical treatments such as rest, physiotherapy, or medication, or radiofrequency or cryoanalgesia, surgery may become necessary in certain cases where symptoms persist or worsen. When is surgery necessary for a herniated disc? So if conservative treatments such as rest, physiotherapy, or medication no longer provide relief and the patient continues to suffer from severe pain, muscle weakness, or difficulty walking, surgery may be required. In particular, when nerve compression significantly affects leg strength or begins to impact bladder or bowel function, prompt surgical intervention becomes essential. What surgical procedures are available for herniated disc? The most commonly performed procedure is called a microdiscectomy, a type of minimal invasive microsurgery. This is minimal invasive operation in which we remove the part of the disc that is pressing on the nerve root. The aim is to relieve pressure on the nerve and reduce both pain and neurosurgical symptoms, all while preserving the stability of the spine. Is general anesthesia required? Yes. This procedure is typically carried out under general anesthesia. However, as it is minimal invasive, patients usually recover quickly and are often able to return home within a day or two following surgery. Will I need spinal instrumentation such as screw or rods? In most straightforward cases of herniated disc, instrumentation is not necessary. However, if there is a spinal instability, recurrent disc herniation, or involvement of multiple levels, we may need to consider spinal fusion using screws, rods, and cages. This decision depends on the patient's specific anatomy and condition. What is recovery like after surgery? Recovery varies from person to person, but many patients are able to walk on the same day as their operation. Light activities can often be resumed within a couple of weeks, and full recovery generally takes around 4 to 6 weeks. Of course, this also depends on the individual's overall health and how closely they follow post-operative guidance. Will the pain go away completely after surgery? The main goal of the surgery is to relieve the nerve compression, which typically results in a significant reduction in leg pain. Some might make discomfort by continuing for a short period depending on the operation areas, but in the most cases, patients experience a noticeable improvement in their overall quality of life. Can the disc herniation again in the future? Yes, even though the current herniated disc is removed, a new disc herniation can develop either at the same level or at a different one of spine. However, there are two key factors that play a major role in the preventing recurrence. The first factor is the surgical technique itself. When performed using the microsurgical method, the risk of recurrence is significantly reduced. The second factor relates to the patient. If the patient doesn't follow the post-operation recommendation carefully, the risk may increase. But if they strictly adhere to the advice, such as avoiding strain, not lifting heavy loads, and maintaining proper posture, of the chance of recurrence becomes much lower. So you can see, with the right surgical approach to proper aftercare, it's absolutely possible to achieve successful outcomes. How do I know if I am a good candidate for surgery? This decision is always made after a thorough evaluation. We consider your physical examination findings, MRI results, and your medical history. If your symptoms are persistent and affecting your daily life and non-surgical treatments have not helped, surgery may be the appropriate next step. What should I ask my doctor before surgery? It is always a good idea to ask about the type of procedure being recommended, the potential risks and benefits, alternatives to surgery, and what expect during the recovery period. Understanding this aspect can help you feel more comfortable and informed when making your decision. Is this a permanent solution? The aim of the operation is to treat certain issue effectively. However, like with a medical condition, there is always a chance to similar problems may occur again in the future. This is why physiotherapy, regular exercise, and healthy lifestyle choices are key part of the long-term recovery and spinal health. Thank you for watching. We hope this video has helped clarify things and given you a better understanding of lumbar disc herniation surgery. We look forward to welcoming you again in our upcoming videos. Take care and see you soon.